Hello, everyone. Welcome to the Laser and Skin Surgery Center's latest webinar. Today, I'm very excited to be here with Dr. Ron Shelton, and he is speaking about what's new in skin tightening, non-surgical treatments. So I see a lot of you are joining right now. We'll just give everyone a few minutes to get acclimated because we don't want anyone to miss any of the important content. As a reminder, this is live, so Dr. Shelton will be available for question and answer. If you're coming to us over Zoom, there is a Q&A button should be on your Zoom screen. It would be great if you guys could populate any questions you might have there, and we will get to as many as we can at the end of the presentation. You can also use the chat if you have to communicate with me or need anything, but ideally questions are in the Q&A portion. As another reminder, we are recording this. I know Dr. Shelton's going to share a lot of information, and if you miss anything, don't worry, it's recorded. You can always watch it back. We'll be sending it to you guys all via email this weekend. So without further ado, I would like to introduce Dr. Shelton. Hi, Dr. Shelton.
Hi, Risa. Hi, everyone. Thank you for having me, and welcome to the second annual webinar at Laser Skin Surgery Center of New York. Tonight's topic is what's new in non-surgical skin tightening.
Yes, and before Dr. Shelton begins, I just want to remind you all, he is a board-certified dermatologist. He is an expert in all types of dermatology, from cosmetics to Mohs surgery, and he has worked the practice for a very long time. We have a number of board-certified physicians that can all do many of the treatments we're going to speak about today. But you are hearing Dr. Shelton's personal opinions and views. This is not being sponsored by anyone, so this is purely just educational to help keep you informed, especially with our brand new device that we're very excited about today, which is the Softwave. So Dr. Shelton, take it away.
I shall. So Ultherapy is high-frequency ultrasound. And unlike diagnostic ultrasound, the high frequency, the high intensity focused ultrasound will deliver, if you see this moving hand on the screen, will deliver energy to certain depths depending on the transducers we use. This was actually invented at a very well-known technology center at Harvard, along with a plastic surgeon who wanted a stopgap measure for his patients who weren't ready yet for a facelift, or had a facelift but need a little touch up, a little more tightening. So without needles, without surgery, the energy is delivered down into the dermis, underneath the epidermis. So the dermis is our building block, our infrastructure of the skin. And collagen is the supporting structure. By inducing more of our own collagen production, we can tighten and even lift the skin. There can be some subtle immediate lifting because the fascial layers here on this monitor, these white horizontal lines, are indicating certain fascial layers that give support. And these are the layers that plastic surgeons will hook their sutures into to do a facelift. But in addition, the Ultherapy can treat the superficial dermis as well. So there are multiple layers. We can see live as we're treating and judge based on the layer that we're in. There are different structural components. So the case that I just did 2 hours ago, using the monitor helped me decide which depth I needed in the posterior cheek versus the anterior cheek. On the lower cheeks, the thickness is different. So we were able to layer different layers of Ultherapy, followed by our newer technology, which is Softwave. And I'm very privileged that our center had been one of the research sites for Softwave. What's very interesting is the difference in Softwave is that there's one layer. It is more superficial than the two deeper Ultherapy layers. And this goes down to about 2 millimeters. And as the beam targets the skin, the energy is layered in at one time in these horizontal bands, and we just go down the face. These are representative photographs, and every patient has sort of a different result. It depends on genetics, metabolism, diet, if you're deficient in certain things that are needed for collagen production, such as vitamin C, smoking, sun exposure, and some comorbidities, maybe diabetes. There are some elastic metabolism problems that some people have inherited, but in general, even from one area of the face to another, responses can be different. So Dr. Kavar treated this patient with, I think, a very nice result, but no one could guarantee that to their next patient. No physician could guarantee that they would get as good a result as this. Dr. Munavali, I think, has produced a beautiful result with Softwave. And this is just 8 weeks after. And I am seeing some results a little sooner with Softwave than when I did 3 layers of Ultherapy, including the most superficial 1.5 millimeter deep. Let's go back. So just in terms of the smile fold here, there's some nice improvement. And this is from Dr. Anissa Ortiz. And from Dr. Lee, if we look at the submental neck and jawline, we have much nicer definition. Dr. Bloom, Jason Bloom, again, a nice sharper jawline. And there are other treatments that we have done over the years to try to induce such improvement, whether it is Ultherapy, as I mentioned, which works well, and Softwave, but there are other treatments like microneedling, ThermiTight, which is more invasive, even liposuction. Botox sometimes delivered into what's called the Nefertiti lift can help improve this jawline. Microliposuction in the jowl, off-label use of Kybella, and things like that. Dr. Roig, Virginia Benitez Roig, I think did a beautiful result here, again in the submental area, but please note the muscle bands in the neck where I'm pointing with this arrow, these muscle bands, the platysma, will not always retract as well as it did here, and sometimes we inject some Botox. Again, we know, and my patients in consultation hear me say to them, a plastic surgeon will provide a better result. We cannot expect to mimic a plastic surgery result by doing non-invasive procedures. But for those of us who are not ready for surgery, or not willing to undergo surgery, or have medical issues preventing them from having surgery, this might be the answer for them. This is our beloved Dr. Geronimus and staff who did a very nice lift of these eyelids. You can see how much lift. This is a good 4 millimeter lift of the upper eyelids by treating the forehead skin to help tighten and lift this whole envelope. Again, Dr. Geronimus and staff, it's a subtle improvement here, but we have a sharper angle of the neckline. Now, this woman had a combination where I did Ultherapy more deeply and Softwave superficially. And what's very interesting on her, what we call paraconcentric smile creases, or the parentheses here, as well as when you look at this side, a greater smoothing. Certainly did not treat the chin, but the jawline's sharper, the cheek overall is smoother. And I'll just read, sorry. So here she wrote a review, and I appreciate the beautiful review. The procedure took about an hour. I left the practice feeling good and confident. And a few hours later, the little redness in my face had almost completely vanished. And that's typically what we see. I'm treating one side of the face, and suddenly, when we're starting on the other side, the redness is starting to fade on the first side. I went out for dinner the same night. Almost the full scope of this treatment's benefit is only visible after a few months, although the full scope. But I could see a difference after a few weeks. And now, 5 months later, I'm very happy with the results. She mentioned to me that even her husband noticed, and that her skin looks firmer, the deep wrinkles have disappeared, and I look very relaxed and natural. Great result. We can't always say that the wrinkles are going to disappear. We aim to help soften those wrinkles. Microneedling with radiofrequency is very different than microneedling alone. Microneedling can be purchased through Amazon and used at home as a roller, but that's very superficial, or done in esthetician's spa. That's not designed to draw blood. It's not designed to have those needles penetrate the dermis. That is a medical procedure. The microneedling that we have done with Lutronic's device, first Infini and then redesigned as Genius, actually delivers the radiofrequency through the needles. These are gold-plated needles, and they are insulated needles, so that we know we're delivering the energy to the exact depth that we want to. There are several other manufacturers. InMode, I believe, has made a very great product in Morpheus. It is different. Morpheus has both insulated and non-insulated needles, and at times we need non-insulated to treat the more superficial layers. But all modalities treat comparably, where the needles come in, and this gelatin model is showing that once the energy is delivered, it's creating a heat effect, which coagulates the proteins, induces microtrauma, to which the body responds by inflammation, which induces new collagen. And here they're showing that we can bilayer one on top of another. It's really fascinating technology. So this was the Infini and the Genius models for microneedling. This is the Genius device. And this is the same patient you just saw in the video. Unfortunately, there are patients that I've done the same thing without as good improvement. Again, we cannot guarantee results, and we can't even predict at times who's going to get a better result. One thing I did do here is at times we apply Sculptra. Sculptra is a product that had been injected many years ago, is FDA approved for the wasting, especially with HIV patients whose medication makes them lose a lot of fat and their face can sink in quite a bit. Sculptra has been applied topically to improve acne scars, surgical scars, and it is basically comparable to what we've used for decades as a dissolving suture. As it dissolves, the body produces more collagen. So by laying it on top of the skin immediately after the microneedling, some component can possibly be absorbed to help induce greater collagen production. But I do think that you can see improvement from laxity here to more of a taut skin. Some of the platysmal bands have improved. The jawline has improved subtly. Again, from platysma bands here to here, and some of the folding and thickness between the creases has improved. So this is a good result, but again, not the same as a neck lift. There are many people who have festoons, which are fluid components right below what we call the tear trough or the eyelid crease. The eyelid is defined as the skin from the eyelashes, which you're seeing in my moving arrow, to the tear trough. This pocket of fluid cannot be drained with a needle. And many things have been tried, but it's very interesting how microneedling can improve significantly. And again, in Dr. Geronimo's case. Dr. Steve Weiner has utilized here microneedling from Lutronic, I think, extremely well. This is, believe it or not, this is sun damage. This is ultraviolet A, deep sun damage. It is not age. Sometimes smoking contributes to it, but this is a very nice improvement. Here, focus on the jawline. This is thanks to Dr. Clementoni in Italy, who utilized the microneedling, radiofrequency, did also some laser for the brown spots, but from here to here is a truly wonderful result. He states here 3 procedures, and that's typical of our microneedling with radiofrequency, done 1 month apart, 3 times. Another case from Dr. Weiner with improvement here at the jowl, along with some of the lines, these horizontal creases. Dr. Edmund Griffin, who's retired dermatologist from Atlanta, significant improvement here, better than what we would expect with 1 microneedling. Even after 3, 6 months is about the peak of collagen production. There can be further out to a year or more. This is almost too good to be true. Crepiness, a very common area, especially as we lose elasticity, lose fluid retention, that we can improve some patients' skin, not all, with superficial microneedling and radiofrequency. Dr. Jason Posner, an excellent plastic surgeon in Florida, this crepiness, kind of like a mommy makeover, not unusual after liposuction or even abdominoplasty. This is a great result after microneedling. And the cleavage creases, we think, from a combination of sun damage and sleeping on our sides and compressing the skin. This is, again, Dr. Monavelli, and a beautiful result. Some sharpness of the jawline from Dr. Mess. And normally for a male bearded skin, we expect less lifting than with women because the whiskers really provide a rigidity, and we're fighting not only gravity, but that rigidity when we're trying to lift. This is a beautiful result from Dr. Clementoni in Italy again. Significant smoothing, again, in these parentheses. This from Dr. Cappuccino. And Dr. Walder, the submental crepiness, significant improvement. Fair number of patients that I performed liposuction in the submental region of the neck will develop this crepiness. Even though the skin retracts and you have a good angle on the profile, you are left with sometimes crepiness that can improve with microneedling. This is another case of too good to be true. Although you're still left with skin that would be tightened far better by a plastic surgeon with surgery, this woman developed a very good improvement for non-surgical treatment, thanks to Dr. Choi. Dr. Diane, Dr. Roerich have improved the skin around the mouth and jawline. I think that this is very considerable improvement from the jowl going towards the chin and having a much straighter line. Beautiful result. Dr. Stephen Mulholland, similar to Dr. Weiner's result of solar elastosis, sun damage, significant improvement. This is with Morpheus. And another Morpheus case, Dr. Diane Dr. Jay Burns, very well-renowned plastic surgeon. And here we're seeing again, jawline definition. Finally, the crepiness over the knee, very hard to treat because of all the gravity, all that pushing down on the upper leg skin, creating these creases. And from very invasive treatment that I've tried, it's not the end all. So microneedling is a good place to start. In the future, we may be blessed with exposure to the deeper Morpheus, which can be used on the body to help tighten, potentially also reduce a little fat. Multi-layers treated at the same time. Thread lifting is done differently. This is not considered non-surgery. It's really minimally invasive when you think about it, but it does provide an additional tool that the dermatologist, a surgeon, has to help lift the skin from the corner of the mouth up to the cheekbone. What she's stating is that, because I don't believe you can hear her, it really lifted her up. It's less than going to a dentist. She said we use a drop of local anesthetic, and she's very happy that she decided. She's really happy she decided. There are different thread lifts like Nova threads, and those are not necessarily tightening and lifting. The InstaLift, the Silhouette InstaLift thread lift, is composed of dissolving suture material that produces more collagen, but it helps hold up the skin, and the results can be 1.5 to 2 years. Suture lifting can be redone and does not preclude, neither do any of the treatments that I've mentioned before, like Infini, Genius, Morpheus, do not preclude oral therapy or Softwave undergoing a facelift in the future. So we're open for questions and answers, Risa.
Phenomenal. Thank you so much, Dr. Shelton. That was great. And there are a lot of questions waiting for you. In the meantime, if anyone has questions now that we're finished, if you could please add them to the Q&A section of the webinar, and we'll try and get through as many as we can. So Dr. Shelton, I am going to just remove your sharing so we can see you a little bit bigger, if that's okay.
There.
All right. So here we go. What kind of anesthetics do you use for Ultherapy or Softwave?
For most patients, I encourage them to allow us to give them a Percocet narcotic and also Ativan to relax them. This requires them to have a ride prearranged who will escort them home. For us here, since I practice on the 11th floor, we really want that companion to come up to accept them and bring them home. It doesn't mean just calling for an Uber and waiting on the street. In addition, we can give Tylenol. We can also give laughing gas, nitrous oxide, and depending on the levels that we treat, sometimes a topical anesthetic can also help. So there are times where we do it all, the topical anesthetic, the Tylenol, the Percocet, the Ativan, and the nitrous oxide laughing gas, and sometimes it just might be laughing gas, or sometimes just a Tylenol or the numbing cream. Many people have an average pain threshold, and I highly encourage them to have some of these modalities to make it more comfortable.
So how long does the Softwave results last?
I think with most of these energy-based devices, because we're fighting the aging curve of what would happen if we do nothing, that on average, it's about a year and a half. I can repeat the devices easily at a year, sometimes 6 months. I do remember when Ultherapy first came out, I was hearing that some Beverly Hills doctors were treating every month. That is way too often, way too costly. Let's let the collagen get its chance to really develop itself before we, reinstill more collagen production.
Great. Can any of these treatments be used on the body on a large area?
What we didn't mention was thermage. I like thermage for skin tightening on abdomen and thighs because it's very time efficient. The actual handpiece is, a good 2-inch square, and the Ultherapy would take quite a long time. But if we do localize it, let's say to an area above the knee or above the elbow for crepiness, some areas of the upper arm, then the Ultherapy could be certainly done. Softwave is a little faster than Ultherapy, and I could easily do that on broader areas if I'm not doing thermage.
Got it. And when do you think the Morpheus body will be available for your patients?
I do want to make it clear that Morpheus body is available in some other practices, but I'm just doing my research, my due diligence at this point. I don't want to make any promises, but I do want you to know that there are therapies out there that, even though our center has more than 100 devices, we don't have everything. So I can't promise as to if we're going to get it and when we'll get it.
So during a consultation, how do you determine what is a viable case? And I guess which modality to choose?
There are patients that come in and they can use one treatment. And we're talking about already having explored potentially Botox and filler. But for true lifting, I'm very conscious of people's pocketbooks and wallets. And although we could do multiple treatments at the same time, I am also quite conservative and try to keep risks very low. I want my patients to have a natural looking result. So some things I will do in tandem, in connection at the same time, and that could be Ultherapy and Softwave. And if I do Ultherapy and Softwave at the same time, we could even consider suture lifting. But when a patient comes in and we're evaluating consultation, I get a sense as to my average results. And if I can produce my average result with good probability based on their thickness of skin, because that matters, their smoking history, comorbidities, sun damage, the amount of sagging that has already occurred, and where that sagging is, I might say to them, we should do Ultherapy / Softwave, suture lifting, and potentially something minimally invasive like ThermiTight in addition, which is underneath the skin, local anesthetic, and delivering radio frequency. There are patients that come to me and I say, looking at your skin, I highly suggest, if you're considering a facelift in a year or two, to not let me treat you, save the money as a down payment to the facelift. It really does matter to some extent on age and their skin type and all those factors that I mentioned.
Okay, so now that you're bringing up plastic surgery, there is a number of questions in here. Obviously, most people came to this session because they're interested in the non-surgical options,
Right.
But there are people asking if you have multiple treatments, will it be a similar cost to plastic surgery? And if you do the treatment now, will it limit plastic surgery options later?
There's not one treatment I mentioned that will limit plastic surgery in the future. with some of the procedures that are done in injecting fillers, there can be sometimes some more scar tissue, as well as these energy-based devices, because we're producing collagen. It might make it just a little bit more involved for the plastic surgeon to do it, but it's done quite commonly. I forgot your first question
Sorry. So if you have
already.
multiple treatments with one of these
Oh, the
non-surgical
cost, right?
devices, might it
Yes.
cost the same?
Usually, if we add up all of the procedures that we were talking about doing for a face, it would not at all be the same as a facelift, depending on where people live. Um, Big cities, the costs are higher. Traveling overseas, the cost may be less. But in the same area, in the same geographic area, if you were to do energy-based devices, plus filler, plus Botox, and maybe suture lifting, you're still probably not in New York City half of what you would be of a facelift cost. And I do want to mention there's some excellent plastic surgeons overseas. But unfortunately, some people don't realize that, everything has a risk. And if you undergo a procedure and there's a complication, you really would like the surgeon who did it to be able to take care of you, because they know exactly, he or she knows what they did better than anyone else. And they're not going to tend to charge you to improve a complication. Whereas if you go overseas, have a complication when you've come back, and you seek a local doctor, they're going to be treating you, they're going to be taking care of you and charging you. God forbid you need hospitalization, your health insurance may not cover you because you went overseas for treatment. I know we're not talking about plastic surgery here. I just wanted to mention that because we're talking about cost, and I did mention about different cities and going overseas. Okay.
I think it's great advice. And I also just want to remind everyone that we have a board certified plastic surgeon, Dr. Hoffman, at our practice, so you can feel very safe with him.
Yes.
So how about downtime for these different procedures?
There are some people who know that they're bruisers. You hardly, they hardly touch something and they bruise. I have seen one patient who bruised with Ultherapy. Softwave is a new kid on the block. I've not seen any bruising with that. So that's basically a non-issue. There are rare reported cases of thin welts, surface lumps, when the superficial Ultherapy or Softwave is done. That could be 1 or 2 days. It tends not to happen. I've had one patient that I treated with Ultherapy superficially on the neck, and her little welts lasted even, I think it was 12 days, but that was the only patient I remember that had that. Microneedling, there can be a bruise. That's very rare. And in terms of certainly fillers, that would be more common. So typically, energy-based ultrasound, we call it colorblind because it can be done on any patient's skin type. We don't tend to see post-inflammatory hyperpigmentation, meaning darkening, and the redness is basically gone within an hour or that evening or by the next day, typically. With microneedling, it's often red for a day or two. There are some rare patients, especially going towards the upper end of skin of color, what we call out of 6 classes, a type 4 or 5 or 6, that might see little dots of darkening. And that's really the skin shedding what it wants to after microneedling. But I had seen one patient where on the thighs microneedling was done with radio frequency, and they had a little darkening. It would be very rare to have it longer than that. There are some people who are prone to melasma, the mask of pregnancy, even though men can get that too. And if they have a history of melasma or significant post-inflammatory hyperpigmentation, let's say to acne or mosquito bites or a burn in the kitchen, they should know that yes, they might have a greater risk than someone who doesn't have that to have darkening after microneedling. But typically it's a day or two.
Okay, so we're getting a lot of questions about costs. I know it's a hard question because we customize, but is there any idea or approximation you can give?
Well, in our practice, that might differ, significantly from where you might have, depending where you live. Every state is structured differently legally. And so you may have a spa do Ultherapy and the cost could be lower. At the Laser and Skin Surgery Center in New York, treatments are done by physicians, not our nurses, not what we call extenders, whether it's a physician assistant or medical assistant. The cost for a microneedling on the face could be in the low 1,000 per treatment, mid 1,000. And in terms of energy-based devices, depending on the area covered, depending on is it a combination of Ultherapy and Softwave or not, is a few to several $1,000s. So I think that's a very good range to get your hands around.
Mm-hmm. So let's see. So many good questions, you guys. Can these treatments be used in combination with fillers and Botox? Is there a recommended time sequencing for spacing out these treatments from your injectables?
There definitely is. These work well together, but not necessarily the same day. The way I like to do things is do the Botox first. You peak at 2 weeks after Botox, or I should say toxin, whether it's botulinum toxin of Allergan's manufacturer or one of the others, Dysport, Xeomin, eventually Revance, Dysport. But you want to give it time to be effective. And after the skin's relaxed, and then we do energy-based devices, and also when we do laser resurfacing, which was not part of the discussion today, for wrinkles where there could be some wounding in the skin, it's nice to heal on top of relaxed skin. Of course, we don't put Botox everywhere necessarily, although with maybe very dilute using aqua gold microneedling we can. So Botox first, and then I like to do energy-based devices, and then filler. If I've done filler, I would wait a minimum of 2 weeks prior to doing an energy-based device. And the same goes for silhouette Insulip threadless. I would do that concurrent with the energy-based device. One of the issues, people sometimes don't have a lot of time. They may live far away. I don't like to change the most optimal plan to convenience them. If that's going to put them at risk, I don't do it. So if we're doing, let's say, an energy-based device that might induce more swelling, and then they are considering Botox, I don't want to do it the same day, even if it's after the energy-based device, because the Botox might diffuse to a wider area because of that microscopic swelling induced by the procedure.
Very interesting. Okay, so which procedures do you think give the best results to tightening under the chin and the neck, setting aside an individual's health situation?
To tighten the skin under the neck depends on how saggy the muscle bands are, how much of a fat pad they have. If we're dealing with patients who just have saggy skin, they have a pretty tight muscle, that's not pushing down, they don't have a fat pad, then for someone like that, I think microneedling could work, but I would still favor Softwave and or Ultherapy. If they have significant platysma muscle bands, we might do a little Botox first to relax them. Unfortunately, the energy-based devices typically don't work well for those bands. If someone has a big fat pad, we really have to reduce that, whether it's liposuction, thermitight, or a combination of those. Kybella, which we did not mention today, Kybella is bile salt. Our intestines use bile salt produced by the gallbladder to dissolve fat. Synthesizing bile salts, allowing the doctor to use these under their neck in the fat pad, is usually performed about every 6 weeks apart, and it can be up to 6 treatments. It can be 3 or 4. There's swelling always that's generated with Kybella for about a week or 2. I call it the jello jiggle, where you feel it waddling back and forth. So you're coming in to treat a bulky neck. Now you have a more bulky neck for that first week. It's better to do in the winter when you can wear a turtleneck. But regardless, that's how we're sizing up our body parts and what treatments we can do. So if we treat the fat first, then we can come back and tighten the skin.
Okay, so what again is the difference between the Morpheus and Softwave?
Softwave is high focused ultrasound, and that's about 1.5 millimeters deep. Morpheus is comparable to the Lutronics Genius and Infinity. Those are both microneedling devices that deliver through the needle radio frequency energy, not ultrasound. All of these energies work by inducing heat. The ultrasound makes particles move. The radio frequency is inducing heat by being absorbed by the collagen and vibrating and causing heat. So heat helps induce more collagen. But the difference in those two is the actual energy. And the microneedling is different than a microneedling device at home, which is not deep, or the microneedling device in a doctor's office, referred to as the pen, which is not delivering radio frequency energy and just causing microtrauma deeper than the microneedling device that you can use at home.
Okay, which gives a more dramatic result, the Softwave or the Fraxel laser?
Fraxel, there are about 4 Fraxels. The ones done in the doctor's office, the 2 common ones are Fraxel Dual, which has 2 different wavelengths, therefore dual. And then the fractional carbon dioxide called Fraxel Repair. For tightening, we expect more tightening from Fraxel Repair, carbon dioxide, fractional carbon dioxide laser with a 1.5 week downtime on average. Fraxel Restore, which is 1 wavelength in the Fraxel Dual, the 1550 erbium wavelength versus the 1927 thulium. Those 2 wavelengths are in the Fraxel Dual. They're not going to lift. This is electrons lifting. Fraxel Dual does not lift. It may help fine lines very well, and we can help sunspots, but it will not lift sagging skin. The fractional carbon dioxide can lift, so can ablative non-fractional erbium laser, something like the Cyton Contour laser. And there's also that 1.5 weeks, even up to 2 weeks of downtime. But in terms of lifting and tightening, without downtime, Ultherapy and Softwave, not Fraxel Dual.
All right. How many treatments of Morpheus are required for the knees? And is there a treatment for general crepey skin on the legs?
3 treatments, at least a month apart. Depending on the person's skin of color, and thinness of the skin, we might extend that to 6 weeks or even 8 weeks apart. And it can be done on the thighs, above the knees, for sure.
Okay, a couple people are asking about jowls. Is that a similar answer to the sagging skin, or would you like to address that separately?
It is. But however, sometimes jowls are created differently. There can be a buccal cheek fat pad that has descended over time. It might have herniated from its position deeper, and it can create a pseudo jowl. It would be very difficult to lift that with any of the treatments that I mentioned, including suture lifting. Usually that's a plastic surgical approach. Off-label, Kybella has been injected into a fatty jowl. There can be some temporary nerve weakness with that treatment, as there can be with Ultherapy and even Softwave, depending on where the provider has aimed their treatment. Other lifting for the jowl is going to be suture lifting. And you've seen a number of slides today where I did see or showed you enough improvement of the jawline. However, the jowl was still present. And it really takes more focus with some of these other treatments. In addition, Botox to relax the musculature, maybe Kybella off label, maybe suture lifting.
Can you explain a little bit more about suture lifting?
Suture lifting with the silhouette Insta-Lifts, which is the only experience I have, because when I did my research, I felt that this would be, for my patients, the longest term improvement. I did like the fact that the suture is strung with these cones, and both the suture material and the cones that are studded, kind of triangular cones, are all of the dissolving suture material, polygalactin that we've used for years in surgery. And that helps produce new collagen. So you get an immediate lift plus more of a long-term production of collagen to help tighten the skin. When suture lifting started a couple of decades ago, it was made out of permanent suture with little spines, little barbs coming off these permanent sutures. At a year, it was found, I know that the Plastic Surgery Society did some research, clinical research, and they found at about a year, there was no improvement anymore compared to the immediate post-operative result. And then you're left with a permanent material that's not producing collagen. And sometimes they were putting in 18 sutures. The Silhouette Insta-Lift, typically it's going to be 3 or 4 per side for the cheek. Local anesthetic at the entry point. Sometimes I usually put a little drop of anesthetic at the exit point. It's one long suture. Half of it is introduced through the middle and comes out on the lower cheek above the smile fold. The other half goes in the same little needle hole. There's no cutting that the first one went through, but exits higher up. Here, we've now massaged it to help anchor the cones within the subcutaneous fat, and then pull this suture end higher, and we see in front of our eyes the cheek rising. It will form pleats, round pleats, like an accordion, always. And you have to be prepared for that. That is going to go away somewhere between a week and 2. However, the central insertion site, usually we put a little Band-Aid on that, and that's it. The exit sites by a day have sealed up. There can be a slight indentation if the material has actually pulled down the skin. So I usually use a magnifying lens as I'm working in that area. And I test by pulling the suture before I trim it. back and forth, I see if that skin in the middle indents. And if I'm moving a suture and the skin lies beautifully in plane, I know there's not going to be a problem. There can be an issue sometimes of the reverse, where there's actually a little bump where one of the cones happens to be sitting over more of a bony prominence, like the arch of the cheekbone.
Mm.
And that would have to be revised through a little needle insertion down the road if it's visible, if it bothers someone. There are doctors that are doing foreheads and necks. I'm a little concerned because for the neck, we have to anchor it back here below the ear where it's very thin above the bone. And it's not uncommon that with the skin being so thin, you actually see the ridge of the suture. In the forehead, one of the issues is that we have such little distance to go that we would need almost a much shorter suture to use. So most of my practice is involved for cheek lifting, 3 or 4 per side.
And just to clarify, suture lifting is the same as threading.
Threading is not, because
Oh.
you can use other good manufacturers like Nova threads that are placed in and not designed to immediately lift, but to lay down more collagen.
Understand. So, all right, we have a lot of questions, but only a few minutes left. So I think two of the ones that people are asking the most are there any, let's see, side effects or reactions from any of these procedures that you're discussing?
Well, I do go over that in consultation. It depends on which procedures we're talking about. In general, with Ultherapy and Softwave and microneedling with radiofrequency, you can expect some tenderness in the areas to the touch, and with smiling or eating, depending on where we've treated, for a few weeks after. It typically is not anything that wakes people up, is not anything that bothers them. It doesn't affect their quality of life. It helps them know we've done something and their body's responding. We want the wounding cascade. We want inflammation. We want the body to know that something has been stimulated to produce through its own fibroblasts, the cells that make collagen, to produce more collagen. And that's what's happening. The risks are extremely low for any burn with these devices. When Thermage first came out about 30 years ago, I'd have to look that one up, the technology was very different and there were some issues. We have not seen that. There's a lot of press on the internet I've read about concern with facial atrophy, fat wasting with Ultherapy. I have not seen that with my patients, but I'm not saying that it can't occur, because there are, some cases that are discussed on the internet. But the point is, the trained provider looking at that monitor knows exactly where they're aiming the beam. They know how to deliver the energy. And I think education experience is a very big part of the safety profile. What else to think of in terms of blisters? I have not seen it with the Softwave or Ultherapy. I have had, with any case we do, around the mouth, if someone has a history of cold sores, fever blisters, which is an eruption from the herpes virus that can lay dormant for decades and then come out with stress, whether it's, God forbid, sunbathing and getting a sunburn, or acutely ill, going to the hospital, stress of worrying about finals, family issues, etc., or facial treatment that stresses the skin, somebody can erupt with a cold sore. If that happens after laser resurfacing for wrinkles, which again was not the topic of tonight, but let's say microneedling, that one little fever blister could affect a greater area of coverage. So if that person has a history of fever blisters, it may be very beneficial to consider taking something like acyclovir or valcyclovir, these medications that can help decrease or ward off the virus.
All right, let's try and get in 2 more questions. So what might you decide is the best treatment for a patient age 61? They have minimal sun damage and would like smoother and younger skin.
Smoother skin could be sun damage, as we showed on some slides, and microneedling would be far better than ultrasound for that. Or laser resurfacing, which again, we really haven't spoken about. There are different levels of roughness of the skin, and there are sometimes that it's precancerous. We wouldn't necessarily treat with energy-based devices precancerous skin, red, rough little patches of what we call actinic keratoses, although the Fraxel laser, the Fraxel Dual, can improve color, can improve texture, and has been shown to be effective in reducing actinic keratoses. It really does depend on what I see. And I'm not looking from across the room. I'm looking right up in your face with good lighting, magnification, trying to assess what's causing the roughness. Is it deep damage, ultraviolet A, sun damage? Is it ultraviolet B? Is it mottling? Is it a roughness from sun damage? Is it roughness from benign seborrheic keratoses that are surface lesions that would be treated differently? So it can't be one blanket answer, but I can say for the texture in general, microneedling, fractional laser over ultrasound treatment.
Got it. Okay. And let's see. I guess to end this off, there's a couple of people requesting that you do a future session on laser resurfacing, maybe since there's so many questions coming up. But I think this might be a good way to end. So a lot of people are asking how you would decide what treatment to do. So maybe what you could do is explain a little bit of how the consultation process works, how you work with the patient to determine what procedure will be best for them, and what would happen if you did think surgery was a better answer for them.
When I see my patient, I'm looking at them from different angles. I'm having my patient show me what bothers them. And sometimes they know exactly what bothers them, and sometimes that is the target that we should approach. But there are other times where a different anatomical area is inducing the effect they see. They may be thinking about some deep folds here when in reality their cheek is sunken in, and that might be addressed better by lifting the cheek into that position, which can be done with Ultherapy, Softwave, suture lifting, and filler prior to treating this. This was what we did 20 years ago without anything else. And I usually say, you know, babies are born with cherubic cheeks and deep smile folds. No one would say, hey, let's inject that baby with filler in their smile folds. But in terms of an average person coming to me wanting to improve their aged appearance, again, have they had any Botox? Is it something that Botox can help? Have they had filler? Is there some weightiness of their face that can be improved with filler without the energy-based devices? If not, we might have to already start talking about a plan. If the face has sagged enough where the jowl has formed significantly, a good quarter-inch below the jawline, we know that Botox and filler for most of those people is not going to be enough, that we will have to do at least some energy-based device. If there's acne scarring in addition to sagging, microneedling might be the better treatment. And in terms of multiple roles, some people have had a prior facelift and they have this drapery curtain folding here because initially they look good, but now 10 years later, things are falling in the wrong vector. They're an energy-based device and suture lifting might be better. It's not easy to answer this question as in a generalization, but looking at the skin from different angles, listening to the history, seeing what was done, and trying to determine the elasticity of the skin. Is it completely shot? And one thing I'd like to address is that, part of the issue of like trying to quit smoking if you're smoking, because that's going to improve your skin health, eating a better diet because too high in sugar is terrible for our collagen production, and also vitamin C consumption. If you're deficient, you're not going to respond well to treatments. But Elastin and some other companies have some products that truly can help collagen production, not just retinols and tretinoin or retin A, but other products, topical products that are shown to help produce collagen, and in the elastin line, elastic fibers. And I have found that for patients, and many of my colleagues have found the same, if we pre-treat for a couple of weeks prior to doing energy-based devices with an elastin restorative complex, which is my favorite for this, we might get improvement. And using the elastin restorative through the treatments and after. Like I typically say, we're not going to the dentist twice a year for cleaning and that's it. We're using fluorinated toothpaste typically every day, and elastin would be that everyday maintenance.
That's a fantastic analogy. I love that. That's a beautiful place to end. I guess I will wrap this up by saying Dr. Shelton is available for consultations. So I know we didn't get to everyone's questions. He'd be more than happy to see you. We do have a number of physicians available at the Laser and Skin Surgery Center of New York. We have a location in Hampton, Southampton, as well as in Manhattan. And since a lot of people were asking about kind of plastic surgery, if that is something you want to explore, we also have a board certified plastic surgeon. So we really can offer the best of all the worlds using our 100 devices and esteemed board certified dermatologist. So Dr. Shelton, thank you so much. I encourage you all to follow Dr. Shelton on social media and the practice so you can stay informed. There is, I know it's after hours right now if you're on the East Coast, but there is a link on our website. You can request a consultation online at any time. And we look forward to seeing you at a future webinar.
I'd be happy to see anyone in consultation, and I wish you all to stay safe and healthy.
Thank you so much, everyone.
Thank you, Risa.
Thank you, Dr. Shelton.
You're very welcome. Thanks for having me. Good night.